Hello, everyone. Thanks for joining our Facebook Live discussion to talk about COVID-19 vaccines. My name is Jonathan Modi with the Health Information Center for Oregon Health Authority's COVID response. I'm joined by OHA Public Health Director Rachael Banks and OHA Chief Medical Officer Dr. Dana Hargunani, who will be answering your questions this morning. Both are heavily involved in our vaccine planning and distribution effort. So let's get started. Rachael, do you want to kick us off?
Yeah, I'm happy to. Thanks, Jonathan, and hello, Facebook Live audience. It's great to be here with you today. First, I'm going to start out with a general overview of the current COVID-19 situation here in Oregon. So as we reported on January 8th, which was the date of our latest COVID-19 model, we estimated that transmission of COVID-19 decreased dramatically between late November and mid-December, before surging sharply upward. And so according to the model, the statewide transmission in late November dropped to an effective production rate of 0.8, meaning that the expected number of secondary cases after a primary case was less than 1. We attribute that reproductive rate of being less than 1 to Oregonians really making a difference by staying home and having smaller gatherings and masking during the Thanksgiving holiday. But unfortunately, what we saw after that was a surge to a reproductive rate of 1.29 as of December 23rd. Anytime we get over 1, we're concerned there that if someone has COVID-19, they're spreading it to at least one other person or over one other person. And we know that that reproductive rate over 1 means that COVID-19, the modeling suggests it's continuing to spread and grow in our community. So that 1.9 reproduction rate does not reflect any potential increase that we may have seen over the Christmas holiday and the New Year's holiday. And any of those social gatherings. We will know more about that modeling update here in the next couple of weeks. But at the current level of transmission, we have a projected average of daily new cases that would be between 1,780. That's about an estimation. And that would be between January 13th and January 26th. And according to that modeling, that would include an average of 85 additional daily hospitalizations. If transmission mirrors the levels from late November to mid-December, the lower reproduction rate, the cases would number about 1,400 and hospitalizations would hover about 55 a day. Given that, though, we're seeing signs of progress as our counts for confirmed positive and presumptive COVID-19 cases have been improving over the past week, which we're glad to see. So cases have been trending downward with the highest number of case counts in the last month on January 7th, when we saw 1,744 cases. Yesterday, by comparison, there were 637 confirmed and presumptive cases reported to the Oregon Health Authority. So the 7-day moving average over the last week has dropped from a high of 1,309 cases to 963 cases. We've also seen the number of deaths thankfully dropped from a high of 144 during the week of December 6th to 44 during the week of January 10th. Unfortunately, we continue to see communities of color experiencing historic health injustices that this pandemic has laid bare, injustices that had led to health inequities before this pandemic, but this pandemic has definitely exacerbated. For example, Pacific Islanders have the highest COVID-19 case rate with 7,302 cases per 100,000 people, followed by those who identify as Hispanic, Latino, Latina, Latinx, with 6,670.5 COVID-19 cases per 100,000. And then American Indians and Alaska Natives follow with 4,959 per 100,000. It's really tragic statistics like these and the stories and the faces that these represent, the families that this is impacting, that make it absolutely a priority for us to have an equitable distribution of COVID-19 vaccines to these and other disproportionately impacted communities in Oregon. And that's why our Vaccine Advisory Committee has been meeting the past several weeks. This committee represents health organizations, community-based organizations, civic organizations, nonprofits, businesses across Oregon, including rural communities, metro communities, and so on and so forth. These folks on the Vaccine Advisory Committee are working tirelessly, have devoted hour after hour, and they represent a broad group of stakeholders from cultural and ethnic communities, migrant and seasonal farm workers, those who work in a variety of different business sectors. So they've been working to recommend ethical principles and ultimately to prioritize sequencing for the next group of Oregonians to be vaccinated. They are making decisions that are squarely rooted in science and community wisdom. And right now we are taking those recommendations and figuring out plans of how we would operationalize them. So today we continue to work with vaccine providers and local public health authorities to distribute the 2 available vaccines made by Pfizer, BioNTech, and Moderna. And we are distributing those to healthcare workers, emergency medical services, frontline responders, and first responders, and staff and residents of long-term care facilities as part of 1A. While the vaccine rollout is slower than we would all want it to, while we have less vaccines than I think any of us would want us to have, they are making their way around the state in every corner of the state. And at this point, we have more than 225,000 people who've received either their first or second dose of one of those 2 vaccines. And now I'm going to hand it over to my colleague, Dr. Dana Hargunani, who's going to provide for you an overview of the vaccines and additional information on our plan to distribute them.
Thank you, Rachel. It is really my pleasure to join the audience today as well. So I want to give a quick update on where we are with distribution of the 2 COVID-19 vaccines, including who is currently eligible, who will be eligible in the upcoming phases of vaccine distribution efforts, and what we're doing to ramp up vaccinations. As of January 18th, Oregon has received a total of 340,000 first and second doses of the vaccine. And as Rachel mentioned, more than 225,000 first and second doses have been administered to people in Oregon as part of phase 1A. Based on currently entered data, the average daily number of vaccinations for the past 7 days has been 12,289 doses administered per day, which means we continue to regularly meet Governor Kate Brown's goal of ensuring 12,000 vaccinations a day. As additional doses of the Pfizer, BioNTech, and Moderna vaccines are allocated to Oregon in the coming weeks, we expect those daily vaccination counts will go up, contingent upon adequate doses from the federal government. In an effort to accelerate our vaccine distribution efforts, we have made some important changes in the recent weeks that should bring more efficiency to the process. Let me give you some examples. First, we've been improving data reporting with ongoing support to local vaccination sites, so our data more accurately reflects actual vaccine administration on the ground, and we have more reliable information we can use to make allocation decisions. Next, we've been encouraging vaccine provider sites to quickly draw down their remaining inventory of doses on hand to lessen the chance of bottlenecks. We are prioritizing allocations of vaccine doses to high volume, high throughput sites and encourage and promote mass vaccination events, such as those organized recently by Salem Health, and today at the Oregon Convention Center led initially by Kaiser Permanente, and soon to be joined by OHSU, Providence Health Services, and Legacy Health on Monday. Such high capacity vaccination clinics will be important in immunizing large numbers of people to help us build the community immunity that will eventually bring an end to this pandemic. We are also ensuring vaccinations to people at the highest risk in phase 1A by leveraging our partnerships through the Federal Pharmacy Partnership Program and state pharmacy and EMS partners to bring mobile vaccination clinics to long-term care facilities, homes serving people with intellectual and developmental disabilities, adult foster homes, behavioral health programs, and other group settings. We have heard from many people who have expressed understandable concern about when education employees and seniors will be able to access vaccines. Oregon has a 12-week plan to vaccinate seniors and education employees, but as OHA Director Pat Allen stated last week, this plan is entirely contingent on receiving the doses of COVID-19 vaccines the federal government has promised states. Here's how we plan to move forward. We will open vaccinations to early learning, childcare, and education employees starting January 25th, recognizing that a handful of counties have already moved through phase 1A and have plans to begin vaccinating education employees sooner, depending on their supply of vaccine on hand. We hope to vaccinate most early learning and education employees within 2 weeks, but as always, that depends on the doses we receive from the federal government. Here's how we plan to take an evidence-based approach to vaccinating Oregon seniors that's consistent with our principles of prioritizing people who are hardest hit and most at risk. We will vaccinate seniors in 4 waves. Wave 1 includes seniors who are 80 and over. This population represents approximately 30% of COVID-19 deaths in Oregon. This initial wave will be eligible for vaccination starting February 8th. Wave 2 will follow and will include seniors who are 75 and over. Wave 3 will follow next, including seniors who are 70 and over. And in Wave 4, we will expand eligibility to all Oregonians 65 and above in those following weeks. Subsequent groups will be determined in coordination with the Vaccine Advisory Committee and shared on OHA's COVID-19 vaccine webpage. These are some examples of the groups who may be included. Critical workers in high-risk settings, including those workers who are in industries essential to the functioning of our society and substantially higher risk of exposure. Also, people of ages with underlying conditions that put them at a moderately high risk, people in prisons, jails, detention centers, and similar facilities, and ultimately the general population. We appreciate the enthusiasm for the vaccines. We encourage everyone to be as patient as they can as we work through this process and ensure the most at risk for infection and serious illness or death can get vaccinated. In the meantime, everyone should continue to practice those most important prevention measures we've talked about so often over the last year. Please wear a mask, practice physical distancing, avoid gatherings and travel, wash your hands often, and stay home if you're sick. Thank you.
Okay, we'll now open it up to questions for Director Banks and Dr. Hargunani. Just a reminder that this is a Q&A on vaccines, so we won't be taking any questions on other topics. The first question comes from Rick. I read that 80% of the COVID-related deaths are people over 65. Why are people in this group not first in line?
Thank you for that question, Rick, and ultimately for the care behind the question of those who are most impacted and those vulnerable folks in our society. So a couple of things come to mind in terms of response. One clearly is the plan that Dr. Hargunani outlined in terms of when and how we're moving through seniors, given that we don't have the vaccine at this point that we would want to have. But I want to also call attention to the first group of folks who are vaccinated included healthcare workers, and that's something that the Centers for Disease Control and other people talked about as well. But what Oregon did was move a step beyond that and include staff and residents. And so those seniors and elders that are living in long-term care facilities, and those were our first phases and our first groups of vaccine prioritization. And part of that absolutely was accounting for where we were seeing those unfortunate deaths and where we were seeing some of those outbreaks. So a number of the people in that age group that you talked about with deaths were living in long-term care facilities. So we wanted to make sure to get to that right off top. What we also know is that Governor Brown has prioritized our education, folks who work in education communities, as well as childcare and early learning. Tons of reasons behind that, including really wanting to make sure that we have our children back in schools. And with that, the intent was at the same time to start vaccinating those folks in our community that were over 65, and for us, we'll start at that over 80. And what ended up happening, much to our surprise, is that we were not given the allocation from the federal government that we had been told that we were going to be given, which really meant we needed to slow our vaccinations down. And so those are some of the things that have happened in the past week. But once again, to underscore, we wanted to get right up top with those living in long-term care facilities. Our next group will be educators, and then our seniors will be moving in right after that, and as we move through this 12-week plan.
Thank you, Director Banks. Next question from Elizabeth. I'm in group 1A and I can't get an appointment to get vaccinated. What can I do?
Yeah, thank you, Elizabeth, and thank you for your service as a healthcare worker and whatever you're doing to take care of Oregonians at this time. It's much appreciated. So the Oregon Health Authority on our website has a couple of options for you to figure out, depending on what county you're in, where you can get vaccinated. At this point, some of the best information is by looking at the county specifically and your local public health authority. And that may mean that there's a mass vaccination site. It's done a little bit differently across different parts of the state. Some places are taking appointments or scheduling appointments, and some are doing walk-ins. So really, and we can post that link to the website in our chat or wherever it's going to go on this Facebook Live. And then there's also what's called a chat bot feature. So you can type in a question and have a conversation as well to get you to the right place.
Thanks, Director Banks. Maria asks, if kids are also getting sick from COVID, why aren't they getting vaccinated? Shouldn't we be vaccinating both teachers and students before schools open?
Sure, I can take that. And Maria, thank you for that question. As a still practicing pediatrician, this one is near and dear to my heart, and vaccines are such an incredible tool we have for preventing illness among children and families. Right now, our available vaccines have not been studied in the younger childhood populations. Moderna has been authorized down to 18 years of age according to its emergency use authorization, and Pfizer has been authorized down to 16. So at this time, we are unable to use those vaccinations in younger children. There are studies underway to better understand the safety and efficacy of these vaccines in younger children, but we do not know yet when we will have this information. I will, note that the Oregon Department of Education, in consultation with the Oregon Health Authority, has a comprehensive plan for returning safely to in-person instruction. So this plan includes extensive requirements around screening, entry, physical distancing, face coverings, quarantine and isolation, et cetera. So I know it's really critical, as Director Banks already mentioned, for us to get our kids back in school, and we'll continue to keep an eye on the data coming forth on these vaccines.
Thanks, Dr. Hargunani. Next question from Amanda. With the federal shortage, are people who have had their first dose going to be able to get their second dose, or is there a risk that won't happen?
I can take that question as well. That's an important one. Thank you. Yes, right now, people should expect that they will get their second dose. That has been how we've been managing our allocation and prioritizing those vaccination allocations. Right now, the CDC and FDA recommend to continue to ensure a second dose. And so that is the pathway we are on, and continuing to make sure those doses are available and allocated. For some individuals, you may have a second appointment already scheduled after you get your first vaccine. And for others, maybe who entered a walk-in type mass vaccination site, should be given an indication of when you should come back for that second dose. For Pfizer, it's a 3-week period between the 2 doses, and for Moderna, it's a 4-week period.
Thanks, Dr. Hargunani. Reed asks, where can I find information on vaccination sites?
Yeah, so our website has information on vaccination sites, and once again, provides the opportunity to link directly with your local public health authority wherever you live, that will give that information, and then as well as how to sign up, and or our website also lists information of where you might be in the prioritization process. The Vaccine Advisory Committee is still working and will be giving more information in terms of that process, but we do know for 1A educators and seniors, and have a plan that you can look at on our website. Thank you, Reed.
Thanks, Director Banks. Next question from Jennifer. Why are college professors not included in the educators who are eligible for vaccination?
I can answer that one. Right now, I know that the concern and focus has been on some of the impacts of the earliest learners on their development and some of the challenges faced when trying to do remote learning, trying to manage the technology, and really the importance of the social emotional development that occurs in the younger years of life. So that's been one of the priorities. We also know that many of K-12 schools have been not receiving children over the last months and end of last year. So that's been the priority of getting those kids back in school first.
Thanks, Dr. Hargunani. Margarita asks, when are they going to start vaccinating people with underlying conditions like diabetes?
Yeah, thank you for that question, Margarita. And we know that those folks with underlying health conditions have potential elevated risks of serious illness. So I appreciate you thinking about that population. The Vaccine Advisory Committee, who has been deliberating, put forward a number of considerations for the Oregon Health Authority. And those with underlying health conditions were one of those considerations, along with those people who may have been exposed or impacted in a correction setting, along with looking at frontline workers who have been or at an increased risk of exposure or serious illness, as well as us looking at where we are seeing health inequities and a couple of other populations, like making sure we're getting to seniors where they're in low income settings. So all that to say, the Vaccine Advisory Committee has prioritized that group, and Oregon Health Authority is currently planning to see how we would implement that. So more to come on the specific dates, but please know that the population of those with underlying health conditions like diabetes is being considered, and the Vaccine Advisory Committee is advocating for the inclusion and their prioritization.
Thanks, Director Banks. This from Daniel. Why have approximately 1/3 of all vaccines in Oregon not been distributed?
I can take that one. Thank you for the question, Daniel. I think there's a couple things. One, some of the doses, for example, that we've received are for second doses. And as I outlined before, there's a specific timing as recommended through these emergency use authorizations by which you need to wait to get that second dose. So some of those doses are being ready just to deliver to that person who's getting their second dose. And so we just need to wait that time. Overall, I think as Director Banks and I mentioned earlier, we have been seeing really more efficiency in moving doses through. And actually, I think right now our numbers are showing that we're doing a pretty good job. I can share a little bit more information on that. Currently, Oregon ranks 8th in the nation in percentage of vaccines administered. That's at 65% as of January 20th today. We also rank 14th in the nation in the percent of population vaccinated at 4.6%. I think we mentioned already that nurses and other vaccinators have administered over 225,000 doses of vaccine. We have more work to do, again, to finish getting access to vaccines for those in phase 1A, particularly those that might not easily access some of our mass vaccination sites, for example, and to ensure we're getting doses out to those who are most vulnerable, such as those in our nursing homes and beyond. So I think we are doing better. We are focused on continuing to be efficient in our delivery and making sure those most vulnerable are getting the doses that they need.
Thank you, Dr. Hargunani. Nazario asks, when vaccines are available to the public, will they have a cost?
That is a great question. And the answer is no. When it's your turn and you're eligible to get a vaccine, there should be no cost to you. We do know for people who are insured that vaccine providers may bill your insurance for part of the administration of the vaccine. But the vaccines are being purchased through US tax dollars at the federal level, and you should not be paying any cost out of pocket.
This next question is from Elizabeth. Lane County has a significant shortage of vaccines, so much as the Public Health Division is turning those in 1A away. What plans are in place to make sure supplies are appropriately allocated to the areas in need?
We can talk about that, and then Dr. Hargunani, please feel free to jump in. So what we've been doing at Oregon Health Authority is working with our local public health partners to understand what their capacity is to distribute vaccine and where they are in that 1A categorization. We definitely want to make sure that counties across the state have enough vaccination to get through their 1A population. And that's looking a little bit different, depending on a variety of different factors across the state. I can tell you that Lane County has phenomenal public health leadership in their health officer and administrator, and just a great team of folks that I have utmost confidence in, and we'll be continuing to work with Lane County to ensure that we can get vaccines allocated. I think one of the really challenging things that has been in this vaccine rollout, which has this great hope and we're really excited, is knowing that we ultimately don't have enough vaccine, and that you know, we've had to make decisions in terms of allocations that we know has not always given everybody everything that they need. So we'll be continuing to work with local public health authorities like Lane County, and really we want to make sure that folks in 1A are vaccinated.
This next question is from Sage. How and where do I find out when it's my turn to get vaccinated if I don't have a physician?
Yeah, that's a great question. And we direct people to our website, and it also has phone numbers to call if online isn't the best chance for you. So right now we have links that will show you, are you in 1A, which is the group that's being vaccinated right now. As we continue to set forth more groups, we will update that information, and ultimately also have a variety of different communication strategies like this Facebook Live and other press releases and whatnot to make sure that folks understand when it's their turn, that they know, and that they know where that they can go.
Kate has the next question. When are additional doses of vaccines from the federal government expected to arrive in Oregon?
I can start on that one. Thank you for that great question. So we are getting weekly allocations from the federal government. That includes allocations for the first dose for Oregonians, as well as allocations for those second doses that we're planning, that we are committed to making sure people have access to. What we're still continue to be uncertain on is the number of those doses that come week to week. So we have a sense for the few weeks ahead, but we get more accurate information week to week. We are hearing that there's expected increases in manufacturing and production, possibly ahead, which we're extremely optimistic about, but we don't have the level of detail to be able to plan for that yet. We also know that there's likely to be additional vaccine candidates being reviewed here in the not too distant future, which would also potentially increase our allocation to the state as we head forward. But for now, we continue to receive our weekly supply from the federal government and looking to see how those might expand.
Next question from Tim. Are COVID vaccinations available in Eastern Oregon?
Yes, COVID-19 vaccinations are available in Eastern Oregon, and we're working with a variety of Eastern Oregon counties to move through their population. I'll just say initially, the first vaccine that came out was Pfizer, which required ultra cold storage. And so in the initial allocations in the first week or so that vaccinations were distributed, those vaccinations were distributed to hospitals that had that ultra cold storage, which were less so in Eastern Oregon. But quickly after that, the Moderna vaccine came out and has been distributed across in all counties. So we've distributed vaccine to every single local public health authority or county, as well as many hospitals throughout the state. And our website can tell you more specifically, depending on your county, and where you can find vaccine when you're eligible.
Thanks, Director Banks. John asks, how will people who have mobility issues and don't have transportation get to COVID vaccination clinics?
That's a really important question. Thank you for asking that. We are working with a variety of partners to ensure that vaccine access can be really mobile, bringing to people who can't come access a clinic or a mass vaccination site. Right now, our federal pharmacy partners are helping to ensure those vaccines are being received, for example, at skilled nursing facilities and other long-term care facilities. We're also working and building our state partnerships to be able to do the similar access points and mobile vaccine clinics for additional people who may not be served through this federal pharmacy partnership. So for example, we have some events happening the end of this week with Safeway as a partner to do just that. We are working with some of our EMS partners who are able to also serve this type of role. I would encourage if you are needing some type of access that is not being provided at a mass vaccine site to reach out to your local public health authority, and we can work and partner with them to make sure you're getting access to the vaccine when you're eligible.
Thanks, Dr. Hargunani. Just a couple more questions, including from Lauren, who asks, do we have an estimate for when everyone will be able to get the vaccine?
The short answer is I wish, Lauren. We do not, and there's a number of reasons for that, including we just are not certain with what sort of allocations we'll be getting from the federal government. We're hopeful there are additional vaccines that are that could hit the market, and so that would provide additional capacity. But that question, which I know is the million-dollar question of when will we be done or when will this group get vaccinations, we're not totally able to say. In terms of long-range estimates, we want to definitely prepare people for the fact that it's going to take longer than what any of us would want it to, and that we fully anticipate that we will be continuing to vaccinate people into the fall.
Thanks, Director Banks. The last question is from Sherry, who asks, when will essential workers be eligible for COVID vaccinations?
Yeah, and so once again, the Vaccine Advisory Committee, which is made up of a group of phenomenal and very thoughtful people, has asked us to consider frontline and essential workers as part of the 1B, if you will, or one of the upcoming groups. So that is something that is under consideration, and we will be looking at that and then ultimately communicating to the public of when, as we get closer to that date, when we think that will occur. But once again, this is a group of workers. Thank you for your service to Oregon, essential, critical workers, frontline workers, whatever terminology folks are using. Thank you for that service and understanding that there is risk in that. Our Vaccine Advisory Committee has prioritized that group as well.
Okay. Thank you, Public Health Division Director Rachael Banks and Chief Medical Officer Dr. Dana Hargunani. And thank you everyone for joining us today. We welcome your continued questions on our Facebook page and have a wonderful day.